So the dilemma really basically, we can't really afford to cover people in the current system, but we can't afford not to. There are consequences if we don't cover people through this traditional method. It simply bubbles up in another place.
The consequences of doing nothing to replace GAMC are simply unacceptable from an economic and a moral and human point of view.
The loss of GAMC for Hennepin County Medical Center is a devastating one. $43 million in 2010 and $50 million in 2011. We see 2,500 inpatients, which 70% of their revenue coming from GAMC, more than 12,000 emergency room visits, 3,700 ambulance runs, 20,000 clinic visits, 2,600 diagnostic and lab procedures, 2,000 outpatient surgery procedures, and 7,000 various other kinds of services that were provided just to GAMC patients. The expectation would be that you could make it up from other payment sources, but there aren't that many private payment sources in safety net hospitals, so there's nobody to cost shift to. Plans for 2010, we're looking at an additional 150 to 200 positions that we are going to be eliminating, so that has an adverse impact on the economy and ironically results in more people without insurance.
Most people don't know anyone on GAMC. Most Minnesotans don't know anyone on GAMC.
St. Stephen's interviewed literally hundreds of their clients to ask them what would happen if they were to lose access to these benefits.
It was never the Plenty administration's intention to abandon these people forever. It was a matter of, look, we have severe budget problems, healthcare costs are going crazy, healthcare costs in this particular program are out of whack. So with the full understanding that the players would get together and try to make things better. And I'm gathering, especially from Michael's remarks, that is precisely what is happening, and that is good news.
Why was general assistance medical care vetoed in the second year of the biennium? Okay. Secondly, why, when the governor then had to take this next step, why was it March 1st? Well, if you think about all of that, you can draw an assumption. The assumption is this: the administration is open to a resolution. The administration is leaving it up to the legislature to come up with an acceptable solution, and that's the operative part, an acceptable solution.
The Department of Human Services and the governor have made an important step in allowing people to automatically transfer from GAMC to the Minnesota Care Program. That's something. It helps some people for a temporary period and as kind of a stopgap measure. There's nearly a consensus in agreement that we need to go into the session with a very substantially reduced budget for serving the people that are on the program. I think we're coming to peace with that and looking for the various ways that we can do that. An option is looking at other parts of the state budget to shift resources to this program. On the one hand, we can say that health care for the sickest and neediest people in the state may be right at the top there of our priorities. But there's another point of view, and it's an important point of view, and that is that there is the view that we're already taxing enough, we're already spending enough, and that our problem is not that we need to tax and spend more, but that we need to figure out how to set better priorities in health care. Looking at the actual eligibility and enrollment process for programs, and as we've dug deeper into the issues, part of the challenges in finding a solution is how complex our programs are, how difficult it is to apply for them, how long it takes to get those programs approved. Option is helping people who may be eligible for other programs get on those programs. So we do believe that a large percentage of people on GAMC are probably disabled. They haven't documented it yet. They haven't applied for programs, like Medicaid or get on Social Security and Medicare. But we think we can help people do that. And that would be another area, because if we do that, the state cost is left and people are getting a more sustainable and ongoing source of care. Where I think the opportunities are, maybe not for immediate short-term solutions, but longer term, and that is changing the incentives of the healthcare system so that we're rewarding things that are efficient, that are effective, that help people stay healthy. The current system rewards the quantity of services. It rewards providing the most expensive services of the options that are out there. We need to flip that around so that there's really an incentive for the providers and the patients themselves to live healthy, to find the services they need to stay healthy. I think that more than ever before, there's a realization that we have to look beyond healthcare to the needs that people have that affect their health, that are not healthcare services as we've thought of them. It's housing and transportation. It's other needs that they need to be met.
Maybe it's not that we need more money, but we need to spend what we have differently. In this case, with housing, healthcare, and support services linked. You don't provide one without the others.
And I think acknowledging that we're going to spend a lot less for the program, we have to target that money better. And I've seen growing support and a kind of galvanizing thought around, in particular with the hospitals that are being hit the hardest, that we probably need to focus some additional resources to those hospitals. If we can't provide all the hospital care, all of the, or payments for all the hospitals, we should at least target some funding for those that are being hurt the most. One of the purposes of the provider taxes were really trying to capture the money that the losses that providers will experience if an uninsured person comes in because they don't have insurance, use the money to pay for the care up front so that people have coverage and then a source of payment. So the provider tax was in part a way to recycle money back from the downstream up to the upstream, but it is a very controversial concept.
Those of you thinking bipartisan solution, as the one of my favorite gangster movies, Goodfellas, said, forget about it. It's not happening. Divides, and today we're divided over the role of government. A few decades ago it was civil rights, and this has really splintered our country, and the political parties are to some extent reflecting those divides. So in other words, the debate about health care reform is occurring in a context that is, in truth, the most polarized we've seen in a century, and the press is reflecting that. It is not causing it. It is reflecting a profound change in our political environment, the nature of our political discourse. The second consequence is what all this polarization and its reporting and perhaps bit amplification in the media is doing to Americans. And to put it simply, it's scaring the out of them. Americans are highly dissatisfied with the healthcare system's coverage, cost, and to a lesser extent, quality. Now, the reverse of that is also true, which is when you ask people, how about your own care, the quality of your care? How about your own coverage and the cost? And you'll see almost a mirror image of those numbers. That is, Americans are largely satisfied with their own personal situation, but they see the system as a whole as being really quite off kilter. And both parties kind of battle to prime those different dimensions, and it provides a real opportunity for those who are opposed or have questions about health reform to unnerve folks. Americans became very concerned, worried, anxious about that personal dimension. The concern about how the system was doing, which is primed or activated by that focus on the national or common challenge, was diminished, and the concern about the potential loss was elevated. And that's precisely what we're seeing today, and it's a real warning for anyone thinking that they can go into this environment and simply talk about the vulnerable and think Americans are only going to rally around that. There is a tremendous reservoir of anxiety just under the surface that is easily tapped.
We're not remodeling a house here. You're not remodeling the house. You're not going to fix the roof on this house. You're not going to move some walls. This house is gone. You have to start with a whole new blueprint. I'd capitalize on all of the field work that's been done by all of you and all of the others that have been involved with this issue. You have agonized and brought forth a number of different proposals. I would capitalize on that. I'd also focus on the fact that we're all in this together. This is not a Hennepin County issue. It's not a Ramsey County issue. This is an 87 county issue. And everybody ought to be in this one together.